The CDC says the flu season this year is hitting younger adults especially hard. I'm here with CBS News Chief Medical Correspondent Dr. Jon LaPook.
Ryan?
What about this year is more dangerous for younger adults compared to previous years?
Ryan, it turns out that this year's strain predominantly is H1N1. That's the swine flu, the same strain that caused the big pandemic in 2009. And back then, it affected predominantly young and middle-aged people, which is unusual. Usually the flu really hits the very young, the very old.
Absolutely.
And so this is 18 to 64, and there are a couple of possible explanations. One is, in terms of the older people not getting it, they may have some immunity because they were around decades ago when the same strain came around or a similar strain came around, and the younger people weren't, so they don't have the immunity. The other thing is that the flu doesn't get no respect. remember Rodney Dangerfield, right? Middle-aged people, young people, invincible, super people, they're not going to get the flu. And it turns out they may not be getting the flu vaccine the way they should. So the CDC says everybody over the age of 6 months should get the flu vaccine unless there's a reason not to, like there's a severe allergy to eggs or they've had an allergic reaction in the past.
Speaking of the flu vaccine, the CDC said it was 61% effective for this flu season. Is that a good number? Is that too low?
It's actually about what it is in the past, where it's been about 60, 70%. And you have to know how to interpret that, right? So it's only 61%, but those other people who are still getting the flu may have a less severe form of the flu. And the way this is measured actually is it's 61% fewer people who go to the hospital or go to their doctor with the flu. They don't actually know who gets the flu because how can they know that for everybody?
So many people.
So it's still a good idea to get the flu vaccine.
Is it too late this year already? Did I miss my chance to get the vaccine?
Did you get the flu vaccine yet, Ryan?
Of course I did.
Okay. It's not too late for those people who haven't gotten it yet because it only takes about a couple of weeks to kick in, and the flu season can go as late as May. So the bottom line is, if you haven't gotten your flu vaccine yet, go ahead and get it.
Helpful advice. Thank you so much, Dr. LaPook.